Hello, everyone, and welcome back to Dr. Heather ND. Today, I have a presentation for you that I've actually given to the fourth year naturopathic students at Bastyr University for the last 2 years in a class that they have called Grand Rounds. And it's a topic that I think is important for anyone who's interested in naturopathic medicine or good medicine in general to talk about. The topic is vitalism. And it's actually the core of naturopathic medicine. So true naturopathic medicine is vitalism. It is getting a little bit lost, I feel, in the naturopathic profession today. We're going to go through that a little bit more as we go through the presentation. But welcome, and I'm glad to have you here learning a little bit about this topic. And let's get started. So a little bit of the lay of the land. What we're going to cover in this lecture is we're going to touch on vitalism, talk mostly about some definitions. It's a little bit text heavy in the beginning, but bear with me, we'll get to some more exciting slides later on in the presentation. We're going to reconnect with our naturopathic roots, and we're going to talk a little bit about the naturopathic principles, the therapeutic order. If you are a naturopathic doctor or naturopathic student, you might have a little bit of a leg up as we go through this, and you'll know a little bit more exactly what I'm talking about with the naturopathic principles, the therapeutic order, some of the other references I make throughout this presentation. But I'm hoping and I'm aiming for this presentation to be accessible to anyone. So no matter who you are, if you're interested in this, listen through the lecture, and I'm sure that you will take something from it. You're going to meet a late elder of our profession. In naturopathic medicine, we call experienced naturopathic doctors elders. So that's where this term kind of comes from. We'll also spend maybe 10 minutes going through a video interview with this elder. It's really informative and insightful, and I thought it's great to include it here because I know we're all busy. You could access it on your own at a different time if you want to and view the full thing. And I do encourage that, but I know that everyone, like I said, has their own things to do. They get quite busy, so I thought I would include a snippet of it in here. And then I'm going to list some resources that will help propel your own further personal exploration. So if you're interested in this topic, which I hope you are since you're here with me today, I list a lot of doctors whose work you can check out and who maybe you even want to reach out to and further your knowledge on vitalism. So let's set the scene. So when I give this lecture to naturopathic students, they're in their fourth year. They're kind of all over the place. They still have classes that they have to finish up. They're in the clinic, so they have patients to think about, charting to go through. So, and everyone, of course, has their own personal life going on as well. So no matter where you are, if you're a naturopathic student watching this, if you're anybody else tuning into my channel here in this video, this is what I wrote on the slide. This is my invitation to you. I hope for everyone to be fully open and present and engaged, letting these ideas turn in your minds and allowing yourself to revisit these concepts which were seen early in your Bastyr careers, but now with new eyes, the eyes of students just months away from becoming doctors. Or for you, anyone listening, wherever you're at, I welcome you here now. I personally feel that this is a very important topic, getting to the roots of our medicine and our identity as naturopathic doctors, what we do, who we are as human beings, what keeps us alive, which is our own vital force, and what makes us come alive, which is our passion. So take a deep breath, maybe picture yourself here. This will help you kind of get into the mode. I feel like this is a very naturopathic vital scene. So big breath in and out, and we'll jump in. So we'll start with some definitions. If we're going to have a whole discussion around vitalism, let's at least make sure we're all on the same page with talking about what it actually is. So on the slide here, we see that vitalism is defined as a school of scientific thought that attempts to explain the nature of life as resulting from a vital force peculiar to living organisms and different from all other forces found outside living things. This force is held to control form and development and to direct the activities of the organism. The second definition here, vitalism is the theory the theory that the origin and phenomena of life are dependent on a force or principle distinct from purely chemical or physical forces. So there's something in addition to just the physical structure of the body and different functions of unique organ systems going on. There's something else that's animating life and vitality and healing in a person, and this is what we call the vital force, which, if you're not from the naturopathic world, this is key and core and central to, again, vitalism, but vitalism is key and core and central to naturopathic medicine. So this idea of the vital force and working with the vital force in affecting healing is absolutely at our core. So a few more definitions. All living things have an integrated force that maintains and directs life. This is true whether that living thing is human, plant, or animal. This force is a form of energy that underpins all biophysical and biochemical processes and separates living from non-living matter. Throughout history, this spark has had many names and been described in many ways. In the English-speaking world, it has been called the innate intelligence, life principle, life force, vitality, dynamis, regulatory force, or vital energy. In other cultures, it has been known as chi or prana. Hahnemann, the founder of homeopathy, called it the vital force. The hypothesis of vitalism states that living organisms possess a specific kind of energy, the dynamis or vital force. Hahnemann also thought that the vital force had a spiritual nature, but this is not shared by all scientists who believed in vitalism. I added this point in here because I think it's important to look at it from a potential spiritual side as well. So this really depends on the practitioner, the student, whoever you are, wherever you're coming from. You can kind of sit with this idea and toy with it and try to figure out what your idea of vitalism and kind of the nature of it is, and the nature of the vital force. And then finally, Dr. Hahnemann, in his Organon of Homeopathic Medicine, described it as a dynamic, immaterial, spirit-like force that embodies the essence of life and all of its metabolic and functional activities. So ultimately, we're looking at the vital force, or the vis. We call it in naturopathic medicine the vis, V-I-S, as this healing, animating force that both gives and maintains life and keeps working toward health and homeostasis. Now let's look at one of our key principles in naturopathic medicine, which is the healing power of nature. For those of you not familiar, we have 6 key principles of naturopathic medicine, and the vis Medicatrix Naturae is one of them. And I promise this is one of the last text-heavy slides, so just bear with me. The healing power of nature, vis Medicatrix Naturae, is an ancient medical principle that includes reference to the innate ability of the body to heal itself. While acknowledging that vis Medicatrix Naturae can be influenced by anything from physician bedside manner to belief in placebo, medical scholars have typically defined it as an internal healing response designed to repair and rebuild. So that description of the healing power of nature sounds a lot like the vital force, which just came up in our vitalism definitions on the last few slides. So is the vis Medicatrix Naturae a way that vitalism is built inherently into our naturopathic principles and philosophies? This is just some food for thought. Some other food for thought comes when we look even more closely at the healing power of nature. So at first glance, it seems like maybe there are 2 concepts built into one. First, we have the healing power of a natural setting, which I know we've all experienced. Clean air, sunlight, contact with the earth, commonly called grounding, negative ions. On the other hand, we have the healing power of the vital force within us. So are these 2 forces, the living force without and then the living force within, actually separate and distinct, or are they one and the same? I actually don't have a really good answer to this, but I do think that these are important concepts to sit with as growing figures in our field, or again, wherever you are today, because understanding this healing force better will ultimately help us be able to understand and help our patients better. What else helps us help our patients better? And that's the therapeutic order. So if you're a naturopathic doctor or a naturopathic student, you've seen this so many times. If you're not, then welcome to this image. The therapeutic order is, again, a really central component to our naturopathic philosophy. So I know that when I was a student clinician, we used to have these posters of the therapeutic order in our clinic rooms. And I feel like sometimes you see things so many times that you actually stop seeing them. And I kind of considered it like a nice decoration on the wall. At the time, I didn't really quite understand the significance or power of it. But I can't emphasize how much progress you'll make with your patients if you start here. So the way that this therapeutic order works is you start at the bottom and you work your way up as needed and if needed. So at the bottom of this therapeutic order, you have some of the least invasive and often least expensive therapies available for a patient. So you'll see at the very bottom, it's establishing the foundations for optimal health. As you move up the triangle or the therapeutic order, we see a little bit more invasive therapies on each level. But if you work with this therapeutic order, you're likely to see that many of the times, if you start at the bottom, that's mostly what your patients are going to need. And you'll be able to kind of hang out closer to the bottom of this therapeutic order. And that's because the body is built for healing. And the set point of the body is health. So we'll go a little bit more into this in a few slides. Also remember our naturopathic principles. So we already talked about one, which is the healing power of nature. If you don't know where to go with the patient, just come back to this and start here. These have been what sets naturopathic medicine apart and makes it so effective throughout the course of our medicine's history. And there's a reason why they've been so key and central to our medicine for so long. I know that the principles, and again, the therapeutic order, which you see on this slide in a little bit of a different graphic, I know they can seem really simple and basic, but these basics of medicine, I like to say, are actually the essentials of medicine. So you'll see that with these principles, this therapeutic order kind of tied together in the naturopathic philosophy, you're going to make amazing progress with your patients. I listed on this slide some keys to effective, sustainable healing. And if you spend some time with naturopathic elders or even get a chance to work with some patients long-term in the clinic and see their progress, what you'll see coming up again and again is this. If you give the body what it needs, if you remove obstacles to cure, if you clear out the waste, then the body knows what it needs to do to heal. And barring some other unforeseen circumstance, it will. So sometimes you need to give the vital force a little nudge. That's where modalities like constitutional hydrotherapy and homeopathy come in. But in general, what I really want you to come away from this slide remembering is, and this whole presentation remembering, is that the natural state of the body is health. And when circumstances allow, the body will shift itself back toward this state following an imbalance. So the name of the game is really creating those conditions for health, because once you have the conditions for health in place, health is going to result. That's our natural, again, our natural set point. So for all the naturopathic students and doctors watching out there, here's another flashback. So I know for a lot of us at the beginning of our naturopathic training, we were all really excited to get started with the modalities and really dive into the tangible part of the medicine. So some of the philosophy might have been glossed over, but the Organon has some profound healing truths all laid out, which make it a great book to come back to at some point, no matter where in your naturopathic journey or whatever journey you're on, you are. So especially as you see more and more patients and you get to see some healing happen firsthand, I invite you to come back to the Organon. And this is not just for naturopathic doctors. Anybody who's interested in healing and how healing works in the body should check out this resource. So in the Organon, aphorisms 9 through 18 speak directly to the vital force. And I've listed 9 and 10 here because both are very relevant to our discussion today. Aphorism 10, the second one on the slide, goes into how every sensation and function of the body relies on the vital force and would not exist without it. The vital force is the animating substance. Aphorism 9 takes it a step further and talks about the ultimate purpose of the vital force doing what it's doing, which is so that our indwelling, reason-gifted minds can freely employ this living, healthy instrument for the higher purposes of our existence. In other words, as doctors, we're not just helping heal bodies for the sake of healing bodies. We're doing it so that each person can achieve his or her highest potential, which is an amazing calling, by the way. So everyone here listening to this, if you're in medicine and healthcare or helping people heal in any way, this is just amazing. So congratulations and kudos, and thank you for being here. So wrapping up this first part of our presentation with a quote by Hahnemann, which states, "The highest ideal of cure is the speedy, gentle, and enduring restoration of health by the most trustworthy and least harmful way." I remember precepting with the naturopathic elder who you'll see on the next slide, and him always saying, try to find the fewest things that will do the most healing work. And when we choose modalities or treatment methods in an informed way and start at the bottom of that therapeutic order, we're naturally going to be aligned with this approach. So here's a list of elders, naturopathic elders, who have come and gone before. And I include this list because if you're interested in vitalism or you want to know more, seek out lectures, writings, whatever else you can find by these doctors, because they're all going to be chock full of healing wisdoms and insights on vitalism. So if you're a naturopathic doctor or student, you'll probably go through this list and recognize a lot of the names. Terska created Terska's formula. Bastyr, hopefully you recognize it if you're a Bastyr student. Hahnemann, who we talked about in some previous slides. Neep, Lindlar, and others. These are all really big names in the naturopathic world. And Dr. Jim Sensenig, who is pictured here on the right, who unfortunately passed away in November of 2019, is the elder who I got to spend some time preceptoring with, which is basically like shadowing. And that was one of the highlights of my education and actually one of my favorite experiences in general. It was actually my last break of my time at Bastyr, so kind of right at the height of senioritis for most people. And after that preceptorship, I came back so re-inspired and revitalized, no pun intended. And I was just so excited to get back in the clinic and start seeing patients again and start putting some of what I've seen with Dr. Sensenig into practice. So in the image here, Dr. Sensenig's quote reads, "Our job as physicians is not to treat disease, but to restore the sick to health." And this is because we treat patients, not diseases. So if you're in the naturopathic field, you've definitely heard this said before. We're treating patients, we're not treating diseases. And disease is what occurs when there's a gap in our health that allows for it. So if you revitalize someone's health, that automatically sets up conditions so that disease just naturally falls away because there's no room for it. So by restoring health, you automatically treat disease. Here on this slide are some elders of now. So some of these names, again, you may recognize, and a lot of these doctors are still practicing. Some of them put out content, others of them take on younger doctors in mentorship programs. So again, if you're interested and you're a naturopathic student or even a young naturopathic doctor, I highly recommend researching these docs and consider reaching out to them to see if you can have the opportunity to learn directly from them. I can pretty much guarantee that it will be like a crash course. You're going to learn so much from them in such a short amount of time. And if it's anything like my experience with Dr. Sensenig, you'll feel like you really learn how to think like a naturopathic doctor. And the medicine really starts to come together and it clicks and it actually starts to kind of feel simple. And you actually will gain a lot more confidence in the medicine if you're, again, a young doctor or a student, which can be pretty hard to find in the teaching clinic. So definitely look into these doctors if you're interested. Just a reminder here that vitalism is the original naturopathic medicine. Unfortunately, many of our schools, doctors, students are swaying away from this but the core of true naturopathic medicine is vitalism. And if you're interested in the history of medicine in the United States, and what caused the split between these kind of more natural versus more biomedical schools, I recommend these resources as some great places to start. The first book is called Divided Legacy. It used to be required reading in the ND schools. There's actually 4 volumes of this, so it's a really detailed look at the history of medicine in this country. The second is a documentary made by Dr. Rick Kirshner, who is recent president of the Naturopathic Medicine Institute. And the third is the Flexner Report. And if you Google this, even without accessing the entire report, you'll get a really good idea of the story behind it. So again, Dr. Sensenig is a doctor I have to thank for much of my inspiration around this topic. And he used to travel around to all the naturopathic schools giving talks and teaching classes. For some reason, he didn't really seem to frequent Bastyr. That's one of the reasons why I really like to give this talk to the 4th-year students there, because I kind of feel like we're helping keep his legacy alive, and even bigger than that, we're honoring the tradition of naturopathic medicine and the true core of what naturopathic medicine is. So I want to give you a little glimpse of Dr. Sensenig here. Again, we're going to go through maybe just 10 minutes of the video, but I do ask, if you are interested, that you spend the time going through the extra 5 or 6 minutes of the video that we won't cover here. I am going to do some different screen shares here. Bear with me. I am not used to doing all the different shares on Zoom. The video will be worth it, I promise. Okay, so I've resumed the share. You should be able to see now a YouTube video. I will post the link to this in the description below the video so that you can access it. Access it again. Let me just make sure that you can hear my sound. Okay, here we go.
So how do we get reconnected to this this lineage?
Well, let's start with the healing power of nature. You know, in the intro there, you read from the mission, or the vision, I should say, for the NMI. And you might recognize those words as a paraphrase of Hahnemann's work about how the purpose of our intervention as a physician is to help somebody reach their optimal level of performance, not just so that they can be healthy, but so that they can use this, he says, this living healthy instrument for the higher purposes of our existence. We paraphrase to say that we can use this for inspired creativity. So the purpose of health is not just to have no symptoms. The purpose of health is to be able to use one's living healthy instrument, use one's mind, body, and soul for the higher purposes of their existence. Right. And this is a completely different way of thinking about medicine than in our dominant culture. So we go back to the healing power of nature. In vitalist medicine, as opposed to the dominant cultural approach, which is mechanistic medicine, we have mechanism and vitalism. The vitalist holds that the body is an ecosystem where everything's connected to everything else, and not only on the physical level, but also on higher levels of organization and, dare I say, vibration. You know, our predecessors wrote about the immaterial world and about how disease is reflective of what's happening in that world. But in any case, bringing it down to today's conversation, the vitalist holds that there's an agency, a power, a force, something at work in living systems, always tending to bring it back to normal, or as Lindlar says, the perfect type. And symptoms, as we see them then in the vitalist model, are the adaptations and or the manifestation of the imbalance. So if that's true, the only reasonable, logical, rational way to treat symptoms is to restore the balance. That's very different. In fact, it's completely what shall I say, diametrically opposed to what is being done in the dominant system of medicine, where one treats those symptoms or adaptations as if they are the problem. So when we talk about, when we envision a medicine that's consistent with the healing power of nature, we envision a form of medicine that treats the underlying imbalance, not the symptoms or the expression of that imbalance. And that's where I think we have lost our connection with our lineage or those in the past. I mean, a perfect example is I just saw something the other day. It was on a public radio station, and then I looked up anyway, long story short, it was an article about how a medical practitioner in California was hanging out in grocery stores giving people advice about diet. But the story said that food as medicine is no longer a fringe idea. It's been around for decades. And I thought, decades? I think it's been around for millennia. I believe it was Hippocrates that said something about that, right?
Right.
So we have, in the conventional school, we are now seeing an appreciation for how the environment, including foods, affect things. But let me get back to the question at hand. The vitalist understands or sees that the symptoms, whether it's a headache, whether it's a back pain, in fact, I'm fond of saying, a headache is never a headache. A headache is an expression of something else. Low back pain is never low back pain. It's always an expression of something else. That something else could be an imbalance in the system, so on and so forth.
Right.
We don't have a lot of time to discuss all this. But the reason that we founded the Naturopathic Medicine Institute was, again, because we felt it was necessary to understand how to apply the modalities in the model, or in the, what should I say, the paradigm that those who have gone before have bequeathed to us.
Right.
You know, it's like a lost art, and it's also a lost worldview. When we are being taught or teaching our students or our doctors to treat symptoms in the same way that is done in the dominant school with natural substances, they're still treating the symptoms, right?
Right.
So we're trying to get back to that basic idea. And as some of your other guests have said that I know you've talked to, and we've talked to on the Vital Force or in the Vital Conversation, have said, the public is looking for someone who understands how to put that all together. You know, I've been fond of saying many people think that this connecting with our lineage, so to speak, or our going back to the basic principles of natural medicine is somehow reaching into the past. Well, it is, but we're not reaching into the past to be old-fashioned or to find out how things were done in the past. We're reaching into the past to see what our predecessors gleaned from their experience in the real world, where they were able to articulate or learn various truths. So in other words, we don't go to the ancients to learn what they did, we go to the ancients to learn what they learned, you know, in terms of the truths, the laws of nature, so to speak. Right. And what they've taught us is that health and disease is a natural phenomenon, right? And subject to the same laws as other phenomenon in the physical universe. Disease is the inevitable consequence of the choices we make in terms of what our internal and external environment is. Not the doctor's job to just find somebody to treat the symptoms then, but to change that environment. You know, it's been done. If you look at the history of medicine, the people who have understood what I'm talking about, who have practiced and taught this, have done this at great risk, because great personal risk to their reputation, if not their lives, because it calls into question the dominant paradigm in medicine. Right. And in that sense, what they have done in trying to keep this wisdom alive, I mean, there's times when I'm looking at the older books written by many of the authors that you and I have talked about before, from Hahnemann, Kent, Lindlar, Spittler, Wendell, and others. I'm reading these incredibly articulate, deeply philosophical understanding of how health and disease works.
Mm-hmm.
And I'm thinking, are we supposed to know this stuff? I mean, doesn't somebody want to keep this from us? I mean, this is like the secret to what health and longevity is all about.
Right.
So it's clear to me that when we're talking about connecting to a lineage, we're connecting to the wisdom of those who have gone before us.
Right.
Connecting with the wisdom of nature, if you will. I think it was Juvenal who said, he's a first century Roman poet, philosopher.
Mm-hmm.
Never does wisdom say one thing and nature another. You know, those are the same thing. Understand?
Right.
So
Right.
that's what we're doing. And if I think about the sacrifices and the what I want to say, the practice and the teaching of
Mm-hmm.
what we're talking about here, we have been bequeathed a sacred trust.
Right.
On behalf of humanity, really. I mean, I sound
Mm-hmm.
a little religious or esoteric here, but this is the information that someday I'm going to digress. I was at a conference many years ago with a Native American medicine man.
Mm-hmm.
This was 20 or 30 years ago. And he answered a question.
I'm going to pause it here, leave it on a little bit of a cliffhanger for you so that you're intrigued and enticed to go back and visit this. I usually take it a few slides longer or a few minutes longer with the naturopathic students. But I'm going to pause it here just to make sure that we have time to go through all the slides and I don't take this video out too long. So let's get back to the slides. Okay, so this is actually another video of Dr. Sensenig. I'm going to put the link to this YouTube video in the description below this video as well. This one's a little bit longer, but it's one of my all-time favorites. I think I've watched it 3 or 4 times, and every time I do, I get something different out of it. So highly recommend this video. So some of you might have heard of the Naturopathic Medicine Institute, which Dr. Sensenig helped found. They've got some really great Vitalist resources on their website. You can join if you're a naturopathic doctor or student as an associate. You can opt to do their Vitalist Fellow training. If you don't want to commit to anything like that, if you're not in the position to, you can still access a number of free talks between some of the vitalistic doctors mentioned on previous slides and more. So there's a number of hours of really valuable free content there. The way you find this is you visit the website, which is listed on this slide. I'll also link that below. Then you go to events and CE. And if you click on the Vital Conversation, you'll get a lot of those usually hour-long lunchtime chats, but they're on a lot of really great, interesting, informative, insightful, naturopathic, vitalistic information. So all that was a little bit of the theory and some really great resources, doctors you might want to check out, but tangibly, what does some of this look like in practice? So this looks like meeting the patient where they're at. This looks like working to maintain an open mind, not approaching with preconceived notions, no matter how many times you've seen this condition. Because again, remember, we're treating people, not their conditions. This looks like not overcomplicating, so don't get lost in the trees and miss the forest. Of course, don't miss the things that you really shouldn't be missing, and I stress this with the naturopathic students a lot. For must not miss diagnoses, for red flag signs and symptoms, of course, recognize those, act on those. But aside from that, there's probably a much bigger picture that you really need to and should be looking at with every patient. This looks like returning to the basics, again, the essentials. So follow the therapeutic order, start with the determinants of health. This looks like remembering the seemingly too simple yet powerfully effective original naturopathic therapies. Things like constitutional hydrotherapy, homeopathy. These are modalities that really work with and strengthen that vital force. This looks like seeing the whole person, body, mind, spirit. It looks like staying humble and yet at the same time approaching with confidence, because those who have come before have done this successfully for ages. Don't forget the roots and the power of our medicine. So a little bit of a recap. Why it's important to revisit vitalism. It's because it's what sets us apart. It's the true power that naturopathic doctors have that other healers don't have. When in doubt, but all the time, remember our naturopathic principles and start with the therapeutic order. Remember, there is no one who will walk through your door who you can't help. This, of course, does not mean that you shouldn't refer when indicated, but even in cases when you do refer patients, I can pretty much guarantee that you'll still have something to offer them. And that's because we work with so many of those basic foundations of health and medicine. Remember, there is so much more we as NDs have to offer our patients than many other medical professionals have. And again, I'm kind of going through these last few slides from a naturopathic standpoint, but there are other healing modalities out there that are more integrative, that approach from a more holistic standpoint, that work with the vital force or the chi. So this is not all necessarily particular just to naturopathic medicine, but these are some core facets of vitalism that I think are really important to include. So again, there's so much that we have as medical professionals in this kind of vitalistic mindset and philosophy that we can offer our patients. Think of all the tools that we have in our toolkits. So in naturopathic medical school, we learn so many modalities. We learn nutrition, we learn osseous manipulation or chiropractic, we learn homeopathy, botanical medicine, and more. Think of all our training in addressing the root cause. Think of the holistic way in which we approach every patient. So these together make our medicine extremely powerful and effective. Remember these key modalities. So again, as I've mentioned, hydrotherapy, particularly constitutional hydrotherapy, homeopathy, diet therapy. Think of some of those original diet therapy testings and concepts that have been created by the elders. So Carroll food sensitivity testing, a super effective way of testing for food sensitivities, but we don't really use it that often. In my opinion, we should be using it so much more because food sensitivities are such a huge prevalent problem, and yet the testing that's usually done for it is not accurate. At least in most times, there's too many variables that can affect the results, and so it's not the results from a typical food sensitivity test are usually not the be all end all. They're not the whole picture. Botanical medicine, physical medicine, so structural alignment like osseous manipulation. Remember all of these different tools that we have. And if you're a different type of medical practitioner, I'm certain that you have numerous tools in your toolkit too that you can employ in just the right way for a certain patient. Remember that true naturopathic medicine is not green allopathy because we treat causes, not symptoms. Remember that you matter. So in patient care, you and your beliefs and understandings matter. This goes beyond the therapeutic alliance, which is huge and important. It goes beyond the skill sets you have in diagnosing and treating. Your philosophy on health and disease will impact how you treat patients. So I have a quote here by Pellegrino. What physicians think medicine is profoundly shapes what they do, how they behave in doing it, and the reasons they use to justify that behavior. Whether conscious of it or not, every physician has an answer to what he thinks medicine is, with real consequences for all whom he attends. The outcome is hardly trivial. It dictates, after all, how we approach patients and how we make clinical judgments. So spending time with topics like these and really reflecting on what you believe illness, wellness, and medicine to be is really worthwhile because your views around these things shape how you'll treat patients, and thus they'll have a profound impact on all who come to you seeking care. I've listed here some extra readings for those interested. I will share all of these links in the description. I know it's going to be a link-heavy description, but I really want you to have access to all of these afterward in case you want to go back and spend some more time with this. And I want to leave you with some parting words from, of course, Dr. Sensenig. So let me bring you back to another video. This one's a short one, just a minute, less than a minute.
The amount of love and passion that's in this room. And it's that love and passion that drives this medicine. It's that helps. That's the healing force. That's the vital force. It's just incredible to me how much there is in this community. I've often noticed that in this profession, and maybe in others as well, but certainly in naturopathy, there are at least two kinds of doctors. There are those for whom this is their career choice because it's a way to earn a living and maybe some respect or whatever else they're after. And for others of you, the people who are in this room, you're here because this is who you are. You couldn't do anything else. You wouldn't do anything else. And what you have found is that passion and a way to apply it in a way that helps your fellow man.
So I love that video. Let me get back to our slide set. But I love this one, and I just find it so inspiring, and really for me a reminder of really what brought me into naturopathic medicine in the first place, and the fact that I feel like this is the real deal for me. Like, this is who I am and what I'm meant to do. So maybe some other people watching this are feeling the same way about naturopathic medicine or about whatever type of medicine you're practicing or you're interested in or you're researching. So thank you all for coming along with me through this PowerPoint presentation. If you have any questions about naturopathic medicine, I'm always happy to answer them. This is something that I love talking about. Feel free to leave them in the comments section below. And thanks again for being here.